Yeah, greetings. This morning, I want to talk about a disease condition that affects children less than 2 years. Commoner in children between 0 to 1 year, but affects children less than 2 years. You get what I mean? Disease condition, is seen mostly in children between 0 to 2 years. But commonly, the children that come down with it that are most affected in that age group is children between 0 to 1 year, right? This disease condition is called broncholitis. Broncholitis. The weather is very cold, you notice that every now and then your child is running nose, having fever, right? Low grade fever, then sometimes have difficulty in breathing. Every now and then you are going to the hospital, they will nebulize your baby with normal saline, you'll come back, the baby will be fine later. So I want to talk about it. So what is bronchiolitis? Bronchiolitis is a viral infection. It's caused by a virus, right? That is a viral infection of the small airway called bronchioles, right? It affects the small airway called bronchioles. Now, um, what when this happens, right? The child there will be inflammation of that small airway, the small airway, because there's a way the airway is like a tree from the trachea to the bronchus, then to the bronchioles, then to the alveoli, right? It is the bronchioles that are inflamed in bronchiolitis, and it is a viral infection. What causes it? What causes it? Viruses. Viruses that can be spread through sneezing, cough, droplets from the nose and mouth. So when you notice that your baby has it, most likely it's coming from you or from a stranger outside or somewhere, right? And usually when somebody sneezes, another baby sneezes, the baby will pick it, right? Another baby that is infected sneezes, the baby will pick it. Droplets from the mouth, droplet from the nose. You put finger inside your nose and use it to touch baby. Baby will pick it from there. You get. That's what more reason you should not allow strangers to be touching your baby hand anyhow. They are usually droplets from the nose and mouth that causes bronchiolitis, right? And the organism that cause bronchiolitis are respiratory syncytial virus, right? Adenovirus, influenza virus, right? The influenza virus, isn't even COVID virus has also been implicated in causing bronchiolitis. See, bronchiolitis in babies is like common cold in adults. Bronchiolitis in babies is like common cold in adults. So it's a thing. And now, what are the symptoms? What are the symptoms? Yes, another thing you should know is that you notice that since you put your baby in creche, your baby is having catarrh, sometimes fever, sometimes cough. Every now and then, every now and then, is bronchiolitis. Bronchiolitis is different from pneumonia. We'll get there, right? So most of those viruses, all those airway infection, upper respiratory tract infection, you see babies contact or contract in what's it called? In creches, in daycare homes, right? Is bronchiolitis, right? Is bronchiolitis. They get it from other babies. Now, how do you know your baby have the bronchiolitis? I mentioned the running nose, low grade fever, cough, difficulty in breathing, right? Sometimes the child will become very fussy, irritable, inconsolable cry because the child is not breathing well. It affects the airway. And sometimes when you watch the baby breathing, you notice that the nose is going up and down like this, which is not supposed to be. Right? Now, what do you do in this condition when it happens? You need to go to the hospital. When you get to the hospital, your doctor will assess your baby, they will listen to your baby's chest, and they will pick it. They will pick it. And when they pick it, they will start your child on some medications, paracetamol to bring down the fever, some antibiotics, some even antiviral medications. approve antiviral medication. The most important thing they will do for your baby, the most important thing they will do for your baby is what they call nebulization, where they will put normal saline inside a nebulizer and put it on your baby's nose so that it will help. What it will do, it will help reduce the inflammation in your baby's bronchus, your baby's airway. It will help remove the mucus that is clogging your baby's airway and making air exchange difficult. Then it will also, in the process, open up your baby's airway so that baby can breathe very well. You'll notice that immediately they do that for your baby, the breathing gets better. Now, what are the complications of bronchiolitis? Pneumonia is the most common complication, pneumonia. So, I've said so much about bronchiolitis. If you notice your baby is having something like that, especially in this cold, is bronchiolitis, go to the hospital. You'll get better. Baby will be fine. Thank you. Bye bye.